Hey guys, today I wanted to address 5 really common misconceptions, misunderstandings, myths about endometriosis. So we're just going to jump right in. So let's start with number 1. Endometriosis is really easy to diagnose. False. Endometriosis is an autoimmune disease, and that means that it presents itself with dozens of symptoms that are different for everybody. You can take 2 people that have been diagnosed with endometriosis, ask them to name off their symptoms, and they could have a dozen symptoms each, but only 3 of them are the same. It's just different from person to person. So it takes time to diagnose it. And on top of that, there's no blood work, there's no imaging, there's no lab test they can do that can confirm diagnosis of endometriosis. So there's no ultrasound, CT scan, MRI, none of that. It can show sometimes the presence of possible endometriosis, but it does not show necessarily if there isn't, or if what you are seeing is endometriosis. So it can just show that there's something there, but it might not be. And just because they don't see anything doesn't mean it's not there. So really, it's just, it's impossible to diagnose without doing surgery. That's the only verified option right now for an official diagnosis. So number 2, endometriosis is curable. Huge false. Personally, I was told by one doctor to have a child that will cure it. That's about the poorest parenting advice I've ever been told. To create a child that you're not planning for, that you're not, I don't want to say don't want, but yeah, don't want, just to make yourself, more comfortable and have a better quality of life, but screw the kid kind of thing. That to me was just some horrible advice. Another one that I have been told is to have a hysterectomy, because if you have your ovaries, aka the source of your hormones that are feeding the endometrial cells, removed, then you will be cured as well. Also not true. That's a lot like closing the barn door after the horse is already out, because those endometrial cells are already outside of the uterus. That's the whole point. They're already in your abdomen. So by taking out your uterus, it doesn't make sense, because those cells are already out. And those are not the only systems in your body that create hormones. So it's not effective. It's not 100%. It might help reduce symptoms, certainly, but as a general rule, no, that's not going to cure it. So number 3, I've heard endometriosis is so common that it's highly and easily treatable because there are so many different options. That is false. Personally, I have done Depo-Provera shots. I've done birth control pills. I've done Lupron Depot, which is or Depo, however you want to say it, Lupron Depot, for 6 months. That's a cancer treatment drug. I've had 2 surgeries. I've done chiropractor, yoga, weightlifting, walking, changed my diet. I eat less than 20 carbs every day. And I still have endometriosis. It is not curable. But then there are some people who all they have to do is change birth controls, and then they become asymptomatic. That's fantastic for you. And if that's the case, Lord bless you, because that's a miracle. But, it's not one size fits all. It's not going to work for everybody. And some people might find minor relief, some people might find major relief, and some people might find no relief. It's the same as the symptoms. It's across an entire spectrum, and there's just no way to know what's going to work for what person. So you have to work with the treatments that are available to you, see what ones are worth it, what ones are not worth it, and you have to play with what's available and see what works. But like I said, if the first thing you ever tried worked for you, keep it pushing, man. That's amazing. And I truly don't mean that to sound sarcastic, because that would be fantastic and I'm a little bit jealous, not gonna lie. Number 4, similar to the whole treatment for as a hysterectomy, I have heard that endometriosis will dissipate with menopause. So basically what people are saying is if you have a uterus around, you know, your 50s, 60s, whenever you start to enter menopause and your hormone levels start to decrease, I've heard people say that your endometriosis goes away. And for some people, again, that is true. Some people become asymptomatic because those hormones are not feeding the cells like they would when you have a regular cycle. And for some people, there are already so many cells that are outside of the uterus, and there's, like I said before, other hormones that are in your body besides what's being produced by your ovaries, that you may not become asymptomatic in menopause. And that's the same thing as with having a hysterectomy. It's hysterectomy is basically like inducing menopause, and it's really not as effective as it sounds. Like, it sounds good, that'd be great, you know, but then you would have nobody over like the age of 50 that has endometriosis, and that's certainly not the case. A lot of the different drugs that are available, and many of the ones that I have taken, put your body into a temporary menopause. The Lupron Depot, whatever you want to call it, shots. I was on those for 6 months, and that was, for me, brutal. Those side effects were crazy. And I did have a cyst that was bleeding at the time, like while I was in the middle of a course of this treatment. And I did go to my OBGYN, and he was like, not possible, because you're in an induced menopause. Okay, so if I'm in an induced menopause and I have no cycle, why am I bleeding? So he had to go do some research, and became a thing. But yeah, that does not, menopause induced or naturally occurring does not cure your endometriosis. And the last one I think is a really important one to know. I have heard that the severity of your symptoms directly correlates to the severity of your endometriosis. That is not true for several reasons. Endometriosis is graded on a scale of stage 1 through stage 4. Stage 1 being mild and stage 4 being more severe. You can go your entire life and not know that you have endometriosis, either because you were asymptomatic or because you attributed the symptoms to something else and they were more bearable for whatever reason, but have stage 4 and not even know it. And then there's other people that have stage 1 where it's considered more mild, and they're in excruciating pain, they're in debilitating pain, and are not able to function fully as you would think that they would be. So it's actually more based on how widespread the endometriosis is within the body cavity, how invasive it is within the body structures, and where it's present. So if you have just endometrial cells on your inner abdomen, like the abdominal lining, let's say, you may not feel that. That may not cause particular symptoms. But if you have it on your bowels or your bladder, you're very likely to feel that instead. And that can be, you know, if you have stage 1, very mild, but all of it is focused on your bladder or your bowels, it's going to be pretty painful, and you're going to have a lot of symptoms, even though it may not be considered severe. But then you have people that maybe have it severely, you know, all over their abdomen and all over these other structures, but it doesn't affect their ability to function because it's not as invasive. I hope that makes sense. But there is no correlation between the symptoms that you feel and the level of the endometriosis. And they can be, I mean, the scale can just be, boop, there's nothing correlating at all. Yeah, so with having said all of that, I hope this information is helpful. If you don't have endometriosis, but you know somebody who is, I hope that you can take this information to heart and show you have more understanding of the condition. And if you guys have any questions, feel free to drop them below. So otherwise, I hope you found it interesting. Take care.